I'm from Idaho, and it was a privilege to return. I went to the University of Utah as one of the Idaho students, and I was attracted back to Idaho and have a deep family connections to the area. And when I finished medical school, the hospital administrator knew that I was in medical school. There aren't very many doctors that come from our little high school. And so basically after that, he said, well, if you still want a job in 3 years, it's yours. I love the people. I love the freedoms and the just the beautiful nature where we live. There's no place like it. I love Idaho. I stay because of the people I love. Honestly, that's it. It's because of my patients. And I've thought about this question a lot. A few years ago, I had some health problems, and I thought, boy, I don't know if I can keep doing this. But the thing that keeps bringing me back is patients, the people I love, and I don't think I could leave them or abandon them. And I want to keep providing that care. And I find myself fulfilled so much by providing that care. And sometimes you can't solve a person's problem, but you can help guide them to the next step of what needs to happen and help people through some of the most challenging times in their life. And I've just realized more and more as I've gone on what a privilege it is to be a physician. And I've enjoyed working in the small town and the rural community where I'm at. I'm it's really quite an amazing experience. Idaho ranks pretty low on a lot of services, and one of the things is physician staffing, availability of resources, particularly in rural communities, distance to specialty centers. And one of the things I've been a little bit alarmed at, especially during the or after the COVID time period, a lot of our referral network physicians left and retired or left the state. And due to various factors, the number of physicians practicing is always seems to be in flux. So having resources to pull on it and feeling like you're part of a network of physicians is very helpful. Those of us that practice in rural areas, you can feel very isolated. Sometimes you're dealing with a crisis in a blizzard at 3 o'clock in the morning, and you hope somebody will pick up the phone when you call, and sometimes they will and sometimes they won't, or they are quick to pass on it. But it can be a lonely place, and so having a good network of other physicians to feel like you're part of a team, especially when things are complicated, is crucial. And the other thing that I think is essential is as we recruit nursing staff and other ancillary staff at the hospital, and then our administrative team, it makes all the difference, because if they're not able to do what they do best, I can't do what I do best. When you have all those pieces together, it works out like magic.